have never known a more resilient group of humans who honestly want to care for people. Nobody goes to school for 20 years if they don't want to care for people, right? I mean, nobody does the amount of work that it takes and continues to go back to it. What I think we have, unfortunately, in healthcare, the system writ large, created, and not just in this country, it's across the world, we've created too many places where it is hard to do the thing they came there to do. It's hard to take care of people, whether it's the technology getting in our way, administrative burdens getting in the way, things that we see where, you know, as clinicians, they're seeing this should be the way it is, and yet I can't do that because of someone else making a decision that impacts my patient.
Hey everyone, welcome to Heroes of Healthcare. I'm your host, Tim Fisher. This podcast shines a light on people in healthcare who are making a positive difference in our world. By any definition of the word, they are heroes. We're very excited to have Elisa Arespacochaga join us today. Elisa is Vice President of Clinical Affairs and Workforce for the American Hospital Association. In her role, Elisa supports the workforce strategy efforts of the association, focused on strengthening the current healthcare workforce and planning for the workforce needed for the future. We're very excited to have Elisa join us. Welcome to the show, Elisa.
Thank you so much for having me. I really appreciate it.
We're really looking forward to this conversation today. Why don't we start off by just having you share a little bit of your background and maybe, you know, where you grew up and how you decided you wanted to do what you're doing today.
Sure. I am Elisa Arespacochaga. I actually grew up in New York City, moved to Chicago when I finished college, wanted to look for a job, didn't really know what I wanted to do. And I was in graduate school to study biology, and it turns out I am terrible at lab work. I really did not enjoy it at all. But at the same time, I was auditing a class on healthcare ethics. And I was fascinated by this question we had on the midterm exam that was asking the question of a woman who's full-term, pregnant, comes into the ER in labor, the baby's in distress, but she refuses to have surgery, to consent to any surgery. What do you do? And I remember sitting there talking to my college roommate, who at the time was in medical school, and asking her, you know, well, what would you do? I mean, you're in medical school, you might face this. And she's like, then how come I'm not having this conversation? So it sort of led me to look at jobs in healthcare policy, understanding more about how healthcare works and its administration. And it landed me a job eventually at the AHA.
So you now are Vice President of Clinical Affairs and Workforce for the American Hospital Association. I mean, it's a job with a lot of responsibility. You have tremendous insight into what's going on in healthcare in America. How do you, some of our listeners are in healthcare, some are not. How do you, from an education standpoint, like how do you qualify for a job like that?
Well, it's not where I started. I've been at AHA almost 30 years, and I actually started as a secretary, because we still have that title, and have learned a lot of the work that I do on the job. I also pursued an MBA while I was working at AHA. But really, I would say probably the skills I use the most in my job are my ability to listen to our members and hear what's going on with them and bring together the disparate experiences into resources that they can use to make their lives easier and the work that they do, which is so essential, easier to everyone else. Honestly, we spend a lot of our time thinking deeply about those topics that those who are on the front lines of healthcare can only spare a small amount of time. But if we can help them see, here's the pathway to making things better, that's a way that we can help our members really do a lot of the work that they do. one of the things that I find really helpful in the work that we do is the ability to hear examples from across the country. There are over 5,000 hospitals in this country, and they're all doing really neat, really innovative things to support their workforce, for example, which I hear a lot about. And to be able to take those different disparate examples and either help create some guidance or even just share those examples with someone else who might take it and then add their own nuance to it and make a change in their own organization that helps their team move forward. So that's the part that I love the most about my job. It's probably the skills I use the most, is just being able to listen and take in all those examples and then share them back with the community.
I love that answer, because a lot of times we focus on the educational needs for a role. And what you just said is, you started as a secretary, and I do remember the days when it was a secretary as opposed to administrative assistant or whatever. And you've had 30 years experience now, so you can't teach experience, and you can't, in some cases maybe you can, but you can't teach listening as well. So, I mean, learning through experience and learning from asking good questions and listening to smart people, that's a life skill, not just a work skill, right?
Absolutely.
So
Absolutely.
When you started as a secretary at AHA, did you ever anticipate having a job like you do today?
I absolutely did not. This was the job that was going to pay the bills while I figured out what I wanted to do, which wasn't working in a lab. But
you knew that much.
I knew that much. The year and a half, I very clearly understood that was not going to be the thing that I was going to do. But it really gave me an opportunity, and that's one of the beautiful things about AHA. We work with hospitals across the country. It gave me an opportunity to really understand the breadth of issues that our hospitals and health systems deal with on a daily basis. So getting to work with our different types of hospitals, whether they're small, rural, critical access hospitals, whether they're large urban academic medical centers, on some level, many of the issues they face, like the workforce, have similar themes, but they all have very different environments in which they are trying to take care of their communities. And that's the part that keeps me coming back. They're amazing people to work with.
Absolutely. We hear a lot about health equity in today's world, especially in the US, but worldwide as well. You have members, you have 5,000 hospitals around the US. Some of them are in very rural areas. Some are in urban areas. The mix of those 5,000 hospitals is fascinating. From a health equity standpoint, how do you see health equity in the United States at this point in 2024?
I think we, hospitals and health systems, have done a lot of work, and I think there's still a lot of work to do. We have as part of the AHA, the Institute for Diversity and Health Equity has created a assessment for hospitals and health systems to understand where they are on their health equity journey along 6 different levers for transformation. Understanding not only from the point of view of what data do they have, what data are they collecting, how are they stratifying that data to understand where there may be disparities, to the points of how are they doing outreach to their communities, how are they partnering in their communities to understand where are the opportunities to better reach their entire community, particularly underserved members of their community, so that they can do what they are there to do. I don't know anyone who works in healthcare who doesn't go to work every morning thinking, I want to do the best for the people who are in front of me, who I am here to take care of. But sometimes we need to do some more work to make sure that they have the access to care that they need, and that all of that community understands and trusts the organization that is trying to do this work.
How have you seen the landscape of patient care change? Because, I mean, and some people don't know this, but there are people in the U.S. that don't live within 2 hours of a hospital. And, as far, we think we can just go down the street if we're living in a metropolitan area and go to an urgent care or somewhere else, but not everyone has access to healthcare like that. So have you seen telehealth change that?
I think it has. I think it's provided a lot of opportunity to get healthcare to communities that maybe didn't have the level of care. So, for example, I had a chance last summer to see some of the work that Dartmouth Health has done in the Northeast, where they do a huge amount to support many of the small critical access hospitals around Vermont, New Hampshire, and Maine, who may not have the number of specialists available to them. They may have, 2 or 3 physicians in their ED and need support if there is a major trauma that happens close by. And their ability to use telehealth and other opportunities like that and be able to remote in a specialist who can help walk that clinician through, a procedure they may not know well, or help them think through a diagnosis in some detail. That ability to share, and there are a number of health systems that have done this, and particularly in the western part of the United States, there are certainly areas that are few and far between when it comes to hospitals. But all that said, we remain really concerned at AHA about the impact that some of these smaller rural hospitals, where there may not be any other care for hundreds of miles, are starting to close services because they cannot keep them open. So that is something we work on quite closely. And in particular, this year have been looking at the impact of closure of maternal health in rural areas.
Yeah, a lot of times we take for granted certain access to healthcare that not everyone has access to that healthcare even today. So it's there's a lot going on in healthcare, and I love having the opportunity to talk to you, because I think you have a lens and you see a lot that maybe the average person doesn't see. So let's talk a little bit about the workforce, because I know that's one of the areas you're focused on at the AHA. So, and I know this is a loaded question, so it may not be one thing, but what's the biggest challenge to the healthcare workforce today?
The math. And by that, I mean the fact that we have a generational shift coming. The baby boom generation has largely hit their 60s and are on their way to retirement. And they are getting older. They have more chronic conditions. They are needing more care delivery. Unfortunately, my Gen X that's following right behind them is one of the smallest generations. And so the most senior clinicians, the most senior folks you're going to see in hospitals and health systems are going to be fewer and far between, because we are a smaller generation. So we're facing a math problem whereby we have this very large group of people who are not only needing more care, but they're also exiting our employment in many ways. So the average age of a nurse, for example, has dropped something like 5 or 6 years in the last 4 years, because a number of them have reached retirement age, and very deservedly so have retired, and we have a new generation coming in. But that skill is no longer at the same level. So there's a lot of concern. And one of the things we're really worried about is, how do we make sure that we have not only the right numbers of caregivers, but that we think about how we do the work differently. The days of people spending 2 weeks in the hospital because they're having gallbladder surgery, and I remember visiting my grandmother during those 2 weeks she was in the hospital as a little kid, but those days are gone, right? I mean, hip replacements are done outpatient. There's so much we have changed about our ability to clinically move people through the health system quickly, that sometimes I don't know that we've always kept up in the way our workflows most efficiently use technology and the people who are at the bedside. And don't misunderstand me that I think we should replace everybody with technology. At the end of the day, core of what we do, it's people taking care of people. You're always going to need people in healthcare. But could we be more efficient? Could we think differently about what training, and back to your original question about the education, what do we need at the bedside? What do people need at home? What supports can be done through technology, much like we're having this conversation today, that we haven't necessarily thought about in healthcare?
We see the looming shortage for healthcare workers across the board, and that's physicians, nurses. That's all healthcare workers. And as you said, the math, we all know the math is not adding up, that the shortage is not going to get better anytime soon. What are some proactive measures that we can be taking in this country to address the root cause of that? For instance, people wanting to be a physician or wanting to be a nurse, and then making sure enough residencies and fellowships, and that it's not going to slow down and put more tension in the system.
Yeah, I think there are three different things that we can do, and there's sort of the shorter term and longer term options. I'll start with the immediate. One is thinking about how we do the work. So there are workflows and ways that we provide care that probably haven't changed dramatically since the 70s. For example, primary care nursing, where basically the nurse is the person who is responsible for their patient in an inpatient setting. And now you're seeing more and more opportunities where people are thinking more about team-based nursing and thinking more about bringing virtual nurses in to help support that team. And those are ways to think differently about who needs to be at the bedside and who needs to do what in that bedside care. And obviously, as a hospital association, a lot of my focus is on the inpatient space, but there's also opportunities across the board. Thinking about ways that we can do that care delivery differently. For example, I just recorded a podcast with a healthcare leader in Michigan who talked about, they actually realized that for something like 50% of the call lights that were triggered in an inpatient unit, only half of them actually required a nurse to respond. Then what the need was, I need another blanket. I would like a glass of water. Can you help me figure out how to order my lunch on this iPad? So they actually hired a group of team members to do those sorts of things that did not require an RN to walk in the room and help with. And not only was it a great satisfier for the RNs because they could then focus on the patient care they were there to do, but it also was a great satisfier for the for the patients in the beds because their needs got answered so much more quickly because there were available team members to do that work. So I think it's there's a lot of opportunities to just think creatively about the things that we have always done this way, if you will, and start to think about what are some of the lessons, for example, we learned during COVID about the ability to change the way that we care for team members. I don't wish anyone going back to that era and some of the, stresses that were put on our caregivers. But honestly, they're incredibly creative people. They came up with some great ways to do things. So a lot of what we are doing now is trying to harvest those examples and share them more broadly and help people think through how can we change care delivery within our specific needs and requirements in our community, but think about doing it differently so that we can sort of do more with less, but without that doing more with less, just putting more stress on those who are providing the care.
Yeah, the reality is that we are going to have to do more with less. And I think many of us that are in healthcare know that. And I love the focus on creative solutions to not lower patient care, but to increase patient care by doing things more efficiently and come up with different ways that maybe have not done before. And I think sometimes creativity happens when we have no other choice but to come up with solutions. And we're nearing that point, aren't we?
I think so. And I think too many healthcare providers are at a point where they either are starting to feel disconnected from why they went into doing what they're doing, or frustrated by things that they're starting to ask the question a little more often, like, I'm not sure this needs to be this way. Another example that I love is that, I'm sure every single one of us has one or two devices on us that is measuring our heart rate and, potentially measuring your blood sugar and doing all sorts of things. However, when we walk into a hospital, we struggle to make sure that those can connect directly to the EHR, so that now you have a nurse who has to come and check your blood sugar, however many times a day, rather than just getting the data from the insulin pump that is a great invention that you've been wearing for, some number of years. So looking for ways to make sure we can make technology work for us, I think, is another huge opportunity. We, as a field, have not done well with introducing technology. The EHR has been a little bit of a challenge for most, and I think we're starting to see some opportunities where people are trying to better embrace technology and really start with the premise of, what do we need it to do, much less what can it do?
I asked you the question, what was the biggest challenge? And you said a math problem, and no question. But you just touched on something that is an additional challenge, which is the well-being, the issue of burnout for our healthcare workers. Can you talk a little bit about that? I mean, there are different reasons for it, but not only do we have a math problem, but we also have more people leaving the healthcare workforce than we have at any time in history. So you put those two things together, that's not good.
Yeah, I think certainly the impact of the pandemic has been, and I don't know that we'll fully know what that has been for a little bit, but it has clearly impacted our healthcare workforce. They are tired. However, I have never known a more resilient group of humans who honestly want to care for people. Nobody goes to school for 20 years if they don't want to care for people, right? I mean, nobody does the amount of work that it takes and continues to go back to it. What I think we have, unfortunately, in healthcare, the system writ large, created, and not just in this country, it's across the world, we've created too many places where it is hard to do the thing they came there to do. It's hard to take care of people, whether it's the technology getting in our way, administrative burdens getting in the way, things that we see where, as clinicians, they're seeing this should be the way it is, and yet I can't do that because of someone else making a decision that impacts my patient. It's not feeling like they have the tools to do what they need to do. So looking at ways to support people whose biggest challenges may not be a specifically medical issue, but it may be access to fresh fruits and vegetables and a good grocery store. So it is all of those challenges coming together, heightened obviously by the impact of the pandemic and a novel virus where rules were changing, 3 times a day as to what you could and couldn't do and how you should address it. I think it just came together in such a perfect storm, which I hate that term, but there's no better one, of a series of growing challenges, of burdens, and putting things in between caregivers and their patients. And then this just whirlwind of activity and stress and so forth. And I think that what we're going to see on the other end is a clearer understanding that you cannot pour from an empty cup, a clearer understanding that our caregivers cannot take care of people if they themselves are not well. And we need to make sure we help our teams really take care of themselves appropriately so that they can care for others. It is not an easy job. There have got to be easier ways to make a living than working in healthcare. But those of us who are here, whether directly in patient care or helping to support them, we do it because we think it's important and because it brings us a level of value and satisfaction and feeling like we're helping. And the more we can, as a large system, remove the burdens across the system. So from technology to regulation to administration to all of the different pieces, I think we really can help support a stronger team that really, can do the job. I worry that sometimes we let ourselves get in our own way a little too much.
The reason we started this podcast during COVID was, and we called it Heroes of Healthcare. And I know heroes is kind of an overused term now, and some people don't like it. And we haven't changed it. Maybe we'll change the name someday. But the reason we started this was to put a spotlight on the healthcare workers, as you just said, who are giving their lives to help others. And we wanted to put a spotlight on them and share that with our listeners, that because I think we take for granted a lot of times, we take for granted the nurses and the physicians and all the healthcare workers in the systems who are selfless and truly give their time and energy to helping other people. But it's kind of like the starving baker, who bakes great goods for other people, but they don't eat themselves. And we have a problem in our country where a lot of our caregivers are hurting themselves, and the numbers don't lie. So I love that you're highlighting that. And we need to continue talking about this problem because it's not going away anytime soon, and it's not helping the math problem that you talked about earlier. Are there any ways that we can that our listeners can help besides showing more appreciation and being thankful for what we're like? Is there anything from a policy standpoint that you see that can alleviate some of this problem?
Well, I think there's a need for all of the different groups that influence and impact healthcare to work together. And that's part of the work that we've been involved with various groups, but trying to bring insurers and regulators and policymakers and the people in hospitals and health systems and on the front lines and in clinics to talk about where the challenges are together. Because as long as someone, in that list of people who are influencing and having an impact on healthcare, as long as they don't engage and don't have a face in the conversation, it's very easy to think, oh, well, that's something we either can't change or we can't move or will never be any better. And I think the more that we take down that's how we've always done it, and think through what are the ways we can do things differently, I think that's one piece. The other piece is, I think, supporting leaders in really feeling empowered to both deal with their own well-being and address their own well-being, because a burned out leader will burn out an entire team like a wildfire. But giving them the opportunity to also, address their own challenges and create those spaces that allow them to recharge. And when I say that, I don't mean work less, because I don't know anybody in healthcare who's going to work less. I mean, create the spaces where they feel they are getting what they need from their professional experience. So whether it's, taking an hour in the middle of the day to go pick up their kid from daycare so that they can spend that time with them and then going back to the office, quite honestly, or creating some space where they can actually get an extra, 5 or 10 minutes with that one couple that they've seen, for their entire lives and feel like they're family, and, just have that extra 5 minutes to connect with them during an appointment, but making those accommodations so that everyone who is in healthcare really feels connected to the work, but also feels that all of the burden that exists, all of the things they have to do that don't feel like really providing care, are moved off to the side, are handled better. When I think about the difference of, the first time I ever flew on an airplane with my paper ticket and, the amount of time and effort it took and the travel agent who had to book it, to the fact that I walk into an airport, with my phone and my ID and, no one's been involved in that kind of use of technology to make our lives easier so that I can focus on the travel, right? I think there are places we can do that.
I listened to one of your recent podcasts, and I heard a shocking data point. It was specific to nurses. What percentage of a nurse's time is direct patient access or related directly to the patient, and it was 44%. That number was shocking to me.
Yeah, and that's if I remember correctly, that's an inpatient number, but still, there's a huge amount of documentation that nurses are doing. There's a huge amount of time spent, and depending on your role, just making sure you can fill the schedule. Things that, again, technology could help support, answering some of those call lights I mentioned earlier that are things that someone else who does not have an RN degree could do if we had them at the bedside. And I'm not saying, we can all afford to add, a whole army of people to the roles in hospitals and health systems, but starting to identify where are the right roles and the right people and the right degrees and the right training to work as a team. I think those are the places we have a lot of opportunity so that nurses can spend, 50, 60, 70, 80% of their time interacting with their patients. That's why they all went into it.
We're talking a lot about the healthcare workforce on this this episode, and obviously we've talked a little bit about nurses and physicians, but how much does leadership and culture matter within the healthcare landscape as we're talking about the math problem and the issue of burnout and well-being?
I think it's so important. So I have used this slide for years in some of my talks, and I put up a slide that says leadership matters, and on one side is a picture of Superman, on the other side is a picture of Darth Vader. And I ask people, which leader would you rather be? And of course, everyone picks Superman, right? And I say, well, okay, think about it. Superman, and let me preface this by saying I'm going by the movies. I've never actually read the comics. Superman basically took the weight of the world on his shoulders, felt he was the only one who could fix all of the problems, nearly lost the love of his life in an earthquake because he was too busy trying to put out fires elsewhere and save other people. And his solution to, dealing with all of this stress was to go be by himself in a cave full of ice, right? Would you want to be that leader? Or would you want to be a leader who, I may not agree with his tactics, but delegated work to a team, trusted them to do it, held them accountable for doing it? His methods might not have been the most effective, but he at least let the team help do the ambitious thing that he was hoping to do. And usually we get quite a lot of discussion after that. But the point of the slide really is that leadership is complicated. You can't take on the entire weight of the department's problems or the world's problems. But at the same time, you also have to think about how you support the team and how you connect with the people you work with and how you, quite honestly, protect your own well-being in all of that space. How do you make sure that you are not yourself burned out? I don't know anyone who was mean because they were happy. You're usually mean because you're unhappy. So how do we help people think about where are the opportunities to make sure that I can recharge my own battery and help the team recharge theirs?
That's a great analogy. I've never heard the Superman Darth Vader analogy, but that's really good. I'm gonna steal that from you if you're okay with it.
Absolutely.
Because I initially thought Superman, just like you. Like I don't want to be like Darth Vader, but that's your point is valid. And I think leadership in healthcare specifically is very challenging and complex right now because not only are leaders dealing with the workforce issues or challenges, but they also have financial challenges. And, a lot of people think, well, hospitals just make tons of money. That's not necessarily true, is it?
So I often describe the challenge today as this sort of three-legged stool, which is technology, and there's all this technology that's out there that's got a lot of promise that can help maybe address some of those workforce challenges, but it costs money. So when you have the financial challenges of also then meeting your workforce needs, and do you spend on technology, but what if the technology doesn't do what you need to, support the workforce and better care delivery? So you can't take your eye off any of those, the financial, the technology, and the workforce. You need all of them to work together, probably in a way we haven't seen in the past. I can tell you that hospitals, I think it's maybe below a half of them now. It was during COVID, it was up to a half of them operate in the red. So these are not organizations, obviously not all of them, but not organizations that are, just raking in money. Hospitals are struggling. Before the pandemic, 1/3 of hospitals operated in the red. So understanding that the needs and the challenges of both running one of these organizations, but also, replacing the physical plant, things that many hospitals were built in the 1950s. That means and I was about to say 50 years old, which clearly shows where my head is, but that means they're 70 plus years old. So they need to be, in many cases, replaced or refurbished. And all of that takes finances. So really balancing between all of the financial needs of the organization, the workforce needs, and then the promise of technology that could address some of these things is something that I'm sure keeps every single hospital administrator and leader up at night.
Yeah, the complexity of what we're talking about here, it's not a simple solution. You can't just wave a magic wand and fix this issue. But as we wrap up here, I want to thank you for being in the position that you're in, because we need people like you advocating for the hospitals, advocating for the healthcare workforce from a policy standpoint, because we have to solve this problem. And it's easy to talk about everything that's wrong, but we need people pushing for solutions. And you're doing that. So the purpose of this podcast is to put a spotlight on people who are making a difference, and you're making a difference. So thank you for what you're doing. As you know, on this show, the last question we always ask of all of our guests is, who is your hero?
Well, first of all, thank you. We are a team of nearly 500 incredibly talented people I work with. So while I may be the one representing here, there's a tremendous team that does all of this work on behalf of our members. But my healthcare hero, that one's actually a pretty easy one for me. It is my grandfather, who I never had the chance to meet. He passed away when my dad was actually a little kid. But he was a physician in rural Spain in the 1920s and 30s. And he practiced in an era before penicillin. He had in his little black bag, which I have, thanks to my dad, was, he had compassion. He had kindness. He didn't have a lot of medications. He didn't have a lot of resources, but he realized some of the big needs in the community that he was assigned to take care of. And he built his own, basically healthcare system. He and another doctor partnered. Each family in town would go and pay my grandmother a certain amount every month. And that was for the salary of the doctors and the upkeep of the horse that got them around to all of their patients. And they would share the horse between the two towns. And he was able to make a huge difference, to the point where as a teenager, I went back to the town with my dad, who looked a lot like my grandfather. And we walked into the local store, and the man behind a counter, an older gentleman behind the counter, sort of looked up at my dad and looked at him kind of curiously. And we went to pay for what we had bought. And he looked at him and he said, "Aquí los hijos de Don Juan no pagan," which basically means the children of Don Juan, which is what they called him, here don't pay. He remembered my grandfather. as having done so much to take care of this town that, gosh, it would have been 40 years after his death. They still remembered and revered him. And that's the kind of impact on healthcare that I know each one of our clinicians has for someone. So that's why he's my hero, and that's why I do what I do.
Well, that's a great hero to have. And I bet your grandfather, if he was here today, would be very proud of the impact that you are continuing to make and the legacy that you're making your family proud. So thank you for what you do. Thank you for joining us on Heroes of Healthcare, and keep making a difference.
Well, thank you for having me. I really appreciate it. It was a great conversation.